then the next issue is related to preconception planning. So what is preconception health? Why do we need to do it? Why is it so important? What's the rationale behind the recommendations to have a woman come to see us before she's actually conceived? Well, 50% of all pregnancy is not planned. Therefore, we want a woman to be in optimal health if she's having sexual intercourse and is not using a good method of contraception. So the thought is that preconception health care should be done at all annual well women visits for women between the ages of 15 and 44, because these are the ages that usually you're able to conceive. And the rationale is to improve outcomes in the pregnancies. The CDC defines preconception health as the health of women and her partner during the reproductive years. When we do this preconception health, if we find that there are health risks, especially genetic in nature, we can refer the patient and her partner, i.e. the couple, to genetic counseling to determine risks associated with pregnancy. This is especially important if there's a family history of chromosomal disorders or other abnormal pregnancy outcomes in a close family member or in the couple themselves. When we look at health counseling, we're going to do the typical things: diet, exercise. What is their day-to-day life like? How much stress is in their life? Because this can adversely affect a pregnancy. We also want to discuss how and when to conceive. We spend so much time trying to prevent a conception that people actually do not know when do we have sex if we want to have a baby. We want to review any current medications or supplements that a woman is taking that can be a risk to fetal development. Now, this would be true also for the male, because there can be something that can adversely affect the sperm, and then it can cause a problem with the embryo during conception. We need to discuss health behaviors. Is this woman smoking, drinking, using illicit drugs? If so, we need to do the counseling to stop smoking, decrease and ultimately stop drinking, and then stop drug use. And we know how difficult that is. At the same time, we would want to refer her into a counseling service to help her as she's trying to get off of these substances. We want to talk about weight loss if that's needed. We want to assess the home environment. Are there any exposures that a woman might have that could adversely affect her health and ultimately that of her fetus? We have primary and secondary prevention. So primary prevention is preventing something from the very beginning. So an example of this is providing the folic acid to all women, as well as prenatal vitamins prior to conceiving. We would want a diabetic woman to be in really good control prior to conceiving, because if you remember from pediatrics, one of the risks for congenital anomalies is poorly controlled diabetes in the mother during pregnancy. When we look at secondary pregnancy, we're really looking at trying to reduce the risk of problems with the mother. So once again, we can look at diabetes. If a woman has poorly controlled diabetes while she's pregnant, she can end up having complications of her pregnancy that will affect her. So we want to get this under good control. Other issues we need to address in preconception health is obesity. Try and get this woman to lose some weight and to modify her dietary plan so that her fetus has the best possible outcome and the pregnancy itself. Women who suffer from depression and are on antidepressants may need to be switched from one category of medication to another. Many of the SSRIs are not category A or B. In this case, we would want to transition this woman off of the SSRI and onto a different medication that will control her depression but not have an adverse effect on her fetus. We want to look at nutritional deficiencies. Is this woman anemic because she's had very heavy menses and she has a poor diet? Are they not taking in enough calcium? Because what ends up happening, if a woman enters a pregnancy and they are deficient in vitamins and minerals, it's actually the woman who suffers the most, because this fetus is going to suck everything possible out of her so that it can develop normally. We need to discuss exercise. What is safe once the woman is pregnant? Screen the woman for potential exposure to toxins. Primarily, these might be in the job. Are they working in a factory? But it can be in their living environment. Where does this woman live? Is she living next to an oil refinery? Is she living next to a freeway and therefore inhaling all of the dust particles that are being emitted into the air? There's not a whole lot we can do about it, but it's nice to know what the potential is. Anything that we can modify, we want to discuss. And then once again, we're going to address comorbid conditions like diabetes and hypertension and emphasize the importance of optimizing control of these comorbidities. Now let's move on to some of the issues that you may be confronted with in terms of culture. Many cultures do not embrace preconception health or planning. They just go for the pregnancy, and when they're pregnant, they'll finally come in and see us. So among these populations is the Latina women. They are aware of the need for care once they're pregnant, but they are not very knowledgeable about the need to come in for counseling prior to conceiving. The African American population sees no need for preconception counseling, nor do they see the need for interconception care, which is the care between pregnancies. So what can we do as nurses? Well, we can provide community education. Go out into these communities. Where do they meet? Where can we capture these women and discuss the need about preconception health care to optimize outcomes? We can also do one-on-one counseling when they come in for family planning visits, well women exams, etc.